Thank you very much. It's a pleasure for me to have you here to join us in this seminar. Okay, so the bariatric surgery starts many years ago. How many of you have been in diet, in Weight Watchers, and all that things, and you sadness see that all the weight that you lose is rebound? Is 95% of cases happen that. Why? Because obesity is more complicated than just do those things. So it's completely a fact that a person with more than 30 BMI is I don't like to use the word impossible, but it's going to be super difficult to reduce the weight just with diet. When the patient has more than 30 BMI, they are going to need a bariatric surgery, and probably you're going to say, but I'm obese, yes, but I'm not diabetic, and I am not with high blood hypertension. I want to explain it in the rest of the slides why happened that. So is bariatric surgery the answer? When those patients with BMI up of 30, yes, because it's proved that the patients with bariatric surgery, if the patient has diabetes or high blood hypertension less than 10 years, they are going to resolve more than 90% of the cases. In 100%, all those problems are going to better. But when the patient has less than 10 years, 5 years of the recent diagnosis, it's proved that those problems resolve. What are the risks of obesity? Like I told you, the obesity is, all the book says that it's a problem that happens in the hair to the toe and all in the middle, so affects all the body. Because the obesity has a lot of hormone action, so it makes that the insulin doesn't work fine. So is the reason that the patients develop diabetes, because the insulin is not working, because the obesity stops the action. So the pancreas gets tired of producing insulin, and the patient develops diabetic. It's the same with blood hypertension. Imagine that all the arteries or the veins are little tubes that take all the blood. The obesity push all that arteries, all the veins, making the blood pressure increase. It's like when you put water to the plants and you squeeze the tube, the water increase. It's the same with the body. All the pressure of the excess weight pushes the arteries, and all that excess weight pushes increase the blood. And some person, I'm sure that they know what happened with the blood pressure, but for the person who doesn't, the blood pressure, when it's increased, it hurts all the organs. It hurts brain, hurts kidneys, hurts heart. It could develop a heart attack, kidney failure. So it's not just that I'm obese, I'm fine. No. The problem is day by day, is hurting all your organs day by day, year by year, and it's proved that the obesity is the same risk that you smoke 2 packets a day. It reduces the possibility of life 15 years, the expectancy of life, just because of obesity. Because it's proved that if you are super obese, more than 35 BMI, you are going to develop in some point diabetes, and when you find diabetes and you didn't do something strong like obesity surgery, it's proof that you are going to develop in 10, 15 more years some kidney failure, heart failure, and some organ problems. So it's not aesthetic, it's because the health, okay? So all that problems causes the obesity. One of the most important things is that a lot of women can get pregnant, and that is because the obesity struggles with the hormone that liberates the how you say this, ovule, the ovarian, the little female cell. So when the patients reduce weight, a lot of patients get pregnant. So we have to encourage the women that when they had surgery, they have to protect with some of them, because with some patients say, I never get pregnant, so it's no problem, and in 3 months they are pregnant. So we encourage them to use some anticonceptive. So this is for explain that the obesity affects all the body. So